Recording. Okay, thanks a lot, Roma. I'm just going to share my screen. There we go. So, got the details there. So yeah, I'm Alison Glover. I'm the Health and Safety Manager for Tameside Council. And as Roma said, I've got my colleague Jackie with me, and she's going to be monitoring the chat. So if you've got any questions, bob them in there and we'll try and answer them as we go along, just so it doesn't stop the flow of the session. But if you have got any other questions, as Roma said, there's normally plenty of time at the end as well to answer those for you. So the session is around risk assessment, and the idea today is to provide an awareness of the risk assessment process, why we complete risk assessments, how to identify the hazards at work, the 5 steps to risk assessment, and how to complete a risk assessment for your area of responsibility. And I think we've already mentioned COVID, but I think during COVID, that probably highlighted for a lot of people, they'd maybe heard of risk assessments, but that possibly was the first time they'd ever done them. Not that it should have been, I might add, but anyway. And because you're a variety of different organisations, I wanted to frame the session as well around why you need to do them, because for some of your organisations there will be a legal requirement, but for others it's a best practice requirement. But I kind of frame it in, take it that you have to do them, and as I go through the session then it will make it clear why we say that. So in terms of health and safety law, it isn't going to apply to all of your organisations necessarily. If your organisation is officially an employer and employs at least one person, then there are duties under the health and safety legislation. And the Health and Safety at Work Act, it protects employees and others who might be affected by work activities. If your organisation is not classed as an employer and everybody within the organisation is a volunteer and doesn't take a paid salary, then actually the health and safety legislation itself doesn't apply. However, we're still bound by civil law. And under civil law, under common law, voluntary organisations and volunteers have got a duty of care to each other and others who might be affected by what they're doing. Sound familiar? It's the same as the criminal side, but different, because the only difference here is the organisation could be sued for damages, basically, under civil law, if someone's injured as a result of another person's negligence. Even where an organisation is an employer, there could still be an aspect of civil law which applies. But I suppose the thing to highlight here is, even if your organisation is not an employer, you still have a duty under civil law to, and it's a duty of care to anybody who is either volunteering for you or could be affected by what your organisation is doing. So what is a risk assessment? Well, it's a careful examination of what could cause harm to members of the public, staff, volunteers, or anybody else by what you're doing. And it helps us to identify who might be harmed and how they might be harmed. And it also frames for us a way to weigh up whether we've taken enough precautions to keep people safe or whether we need to do more. And as we've already said, it is in some circumstances a legal requirement for certain organisations. Now, the thing to note here as well is, under the health and safety law, it's only a legal requirement to document your risk assessment if there are 5 or more people employed by that organisation. But I'm going to say, write it down anyway, document it anywhere, because if there was an accident or an incident or some kind of investigation, you are going to be able to evidence what arrangements you had in place, what control measures you had considered and put into place to control the risk. If you haven't documented it, it makes it very difficult for you to evidence. Now, what a risk assessment absolutely is not, it's not aware of eliminating every hazard, be that in the workplace or part of your voluntary activities. Everyone, we all have some risk in life. If we didn't, we wouldn't go out the house, wouldn't cross the road. So we have to, we always are going to be doing things which without a level of control would be dangerous. And there's always going to be some element of hazard that is still in existence, but it's about trying to do as much as we can to reduce that level of risk. So there are reasons why we complete risk assessments. As we've said, there is the legal aspect. There's also that moral aspect. If I look at it in terms of us as an employer, as Thameside Council, we want people to come to work, do their job that we're paying them to do, and then to go home safe and well at the end of the day. And it's exactly the same yourself. With your organisations, you want people to come and either take part in the activities you're delivering or volunteer with you, do what they need to do and go home and continue and enjoy, their life at home. You certainly don't want them going home with some significant injury or, worse still, not going home at the end of the day. It's also worth considering that financial aspect as well. If there was an accident and there was an investigation carried out by the HSE, the Health and Safety Executive, they're the organisation that enforce health and safety legislation, they're the regulator. If they came in and they carried out an investigation and they found that as an organisation, as an employer, you were not doing what needed to be done in order to control the hazards that were part of your activities, aside from prosecution and the risk of fines and custodial sentences, they can also charge for the time it takes them to investigate that incident and the measures you have in place. And they charge £163 per hour for that. So that's before even you've got any fines or anything else on top of that. Obviously, as well as an organisation, if you're having lots of accidents, incidents, you haven't got the right controls in place, insurance premiums, things like that are going to increase as well. And if people are aware that your group, your charity or organisation are causing injuries to people, then they're probably not going to want to come and join in with you to take part with new activities or volunteer either. So yeah, lots of very good reasons for us to complete risk assessments as part of ways of managing health and safety. Now, the Management of Health and Safety at Work regulations, these fall underneath the Health and Safety at Work Act. So the Health and Safety at Work Act, which gives that prime duty on employers to ensure, so far as is reasonably practicable, the health, safety and well-being of their employees and others. That is your umbrella act. And then underneath that are various regulations, which are all very specific and give much more detailed information and direction as to how you manage specific areas. And the Management of Health and Safety at Work regs in particular is relevant to risk assessment. And this is the regulation that requires employers to assess the risk to workers and others who may be affected by their work. And you see that term there. Ensure, so far as is reasonably practicable, that exposures to the risks are reduced to an acceptable level. So, as I said before, and I'll keep repeating it, even if you're not an employer, even if your organisation doesn't employ anyone and you're working with volunteers, I want you to consider that this is still what you need to be doing. So just to explain, so far as is reasonably practicable. So reasonably practicable is about balancing the cost of any control measure that you're going to put in place. And we're looking at cost in terms not only of money, but also the time it would take to implement and the effort it would take to implement. And all of that has to be balanced against how much you would reduce either the likelihood of that hazard causing some kind of incident and also the severity, how it could reduce the severity of any outcome of an incident in relation to that hazard. So you're not ever going to be expected to put in place anything that is, you know, disproportionately expensive or time consuming in terms of how it will reduce the risk. So why we complete risk assessments? We've already said it's a legal requirement in terms of if you're not an employer, you've still got to put things in place so that you're meeting your duty of care. And it helps us protect our employees and others, be that volunteers, be that people taking part in the activity. It also helps us focus on the real risks, because we're not, as we said, we don't have to remove every risk that there is. We can't possibly do that. So we're looking at risks which are significant and which could cause injury. And it allows us to identify the preventative and protective control measures that we need to put in place. Hopefully, we're going to then, by doing that, prevent injuries and illness when we're actually putting our activities together rather than as a reflective action. And we've got a document there that we can refer to in the event there's either legal action or a civil case against us. So who should complete a risk assessment? Well, the ideal person to complete a risk assessment is someone who's got knowledge of the actual activities that are being delivered. They've got knowledge of the people taking part in those activities, and they've got knowledge of the location where those activities are delivered. And when I say knowledge of, it's through personal experience. They know the activity, they know the people, they know the environment where they're going to take place. It also needs to be someone who understands risk assessment, who knows what the process is and knows the measures that should be considered to reduce the risk of injury, harm, or transmission in the case of viruses, etc. And it also needs to be someone who can control the way that those activities are delivered. So someone who's got an influence over any changes that may need to be made, any investment that might need to be made, and can control the delivery of that activity. Now, you may look at those criteria and say, gosh, I don't think we've got any one person who can fit every single one of those bills. And generally in the workplace, it isn't one person either. Very much it will be a collaborative approach. So you may have someone who knows the activity very well. It may be one of your volunteers, but they may not have a full understanding of how you do a risk assessment, and they may not have the influence to change how the activity is done or the financial implications if there's any investment required. And so it might be that yourself, now, because you will have knowledge of the risk assessment process if you didn't previously after today, that you would then work with the person who delivers that activity to collaborate and put together a risk assessment. So there are 5 specific steps to risk assessment. This is laid out by the HSE. So step 1, and we're going to go through each of these steps one by one. Step 1 is identifying the hazards. We then need to think about who might be harmed and how they may be harmed by those hazards. We need to then evaluate the level of risk and decide on precautions, decide on the control measures that we can put in place to reduce those risks. And then we've got to record our findings. So that's write them down, document them, and implement them. And then the final step is to regularly review the risk assessment and make any changes and update it as necessary. So one of the things that we'll go through now is hazards and risks, because we need to know what type of things we're looking for when we say we're going to identify the hazard. So this is just an overview. The slides, by the way, we will send out. Sorry, I forgot to mention that. If you're scribbling everything down, we will send those out for you. So we'll start with the hazards first of all, because sometimes it's difficult to understand what do we mean by a hazard. Well, what we mean by a hazard is the actual activity that you would be carrying out that may cause the risk of some kind of harm. So typical things here, this is not all of them obviously, but just typical things might be carrying out a work activity at height, using different cleaning products, lawn working with electricity, trailing wires, working with asbestos. It can be other things like manual handling, using power tools, that type of thing. So there's lots of different things that would be identified as your hazard. But how do you identify the hazard? And this is where you need someone who knows the activity. But you can also see hazards with a fresh pair of eyes. So have a walk around your area, your work area, and look at what could cause harm. Watch the activities underway and see, you know, are there things being done that you haven't thought about that you may need to change how you're doing something or put a control in for. Ask your employees and volunteers, what do they think the hazards are? If they're the people that are doing this, they are the most likely people to know what the hazards are. Use manufacturer's instructions. If you're using equipment, power tools, that type of thing, there will be guidance within the instruction booklet as to what the hazards are and controls to put in place. HSE guidance, approved codes of practice, standards and framework, and also refer to your accident and incident records, because that will also tell you if there are particular risks associated with certain activities, if you're getting lots of accidents as a result of that activity. And what we're concentrating on when we're looking at hazards is things that are reasonably foreseeable. So, and when we say reasonably foreseeable, it's things that the average person in the street would consider a potential hazard. So it's not absolutely everything and anything that we do. It's things that are reasonably foreseeable and significant. So when we're looking at the hazard, what we need to think about and focus on is not only the activity that's being carried out, but the people that are completing the activity as well, because there may be some people who are more vulnerable or less skilled. The type of equipment, materials and substances, these are all things that we need to think about. Is that a potential hazard? Where you're carrying out the activity, are there any environmental hazards that we need to consider and control? And the service users themselves too. So when we come to the next aspect, we've identified the hazard, and then we need to look at who might be harmed and how. And this is where we're looking at the risk. So when we think about who might be harmed, first of all, it's your volunteers, it's your employees, it's your service users, it's any member of the public who may be in the vicinity of what you're doing that may be affected by what you're doing. Particular groups that may be at risk are if you've got young people, less experience, less knowledge of the activity, maybe less physical strength. New and expectant mothers also, they would need their own specific risk assessment if you had new and expectant mothers. And then there might be other people who are there intermittently, who have less knowledge again of your area and what you're doing. And so they need to be considered as well: cleaners, visitors, contractors, maintenance workers, etc. And when we look at how the people might be harmed, the individuals might be harmed, you're looking at severity. What type of injury, how severe might it be? So working at height, it could be a fall from height, which results in severe physical injury, and could be life-changing injuries. It could even be a fatality. If you're working with chemicals, cleaning products, there's the risk of burns, respiratory illness, asthma, dermatitis, injuries, loss of vision to the eye, and the severity would depend on the product. And then if there's lawn working, there's a vulnerability to violence and aggression, there's the possibility of delay in response to an accident, and as it goes on there. So those are the types of things when you're looking at, if you take the actual hazard and what could be the outcome if that went wrong, if it was wrongly applied and there weren't any controls in place at all. And once we've decided who might be harmed and how they might be harmed, we've got to think about what is the level of that risk and how can we reduce that risk to as low as is reasonably practicable. Remember that balance there. When we think about reasonably practicable, it's got to be a balance whereby the reduction in risk is appropriate to the amount of time, money, and effort we need to invest into it. And there's a particular hierarchy of control measures when we're looking at reducing risk. And ideally, what you would want to do is totally remove the hazard if you could. But very often you can't. It's the nature of what you're doing. If you don't have to do it, though, then you don't. You could possibly substitute the hazard or the process with something that is less hazardous. So, for example, in a lot of schools now, bleach as a cleaning product has been reduced with things that are far less potent, but still do the same job while posing less of a risk to anybody who may be using them or come across them in storage. The next step could be engineering controls. And that would be, particularly in the case of machinery, for example, guards that are put in place, because you still need to use that piece of equipment. You can't substitute it with anything less hazard. So what we can do is make that piece of equipment safer by putting in a guarding system on the equipment, for example. Then you've got the next level of control, which would be administrative controls. And that would be having in place a safe system of work, ensuring that people using this process, doing this work activity, providing this service, that they are trained, that they've got the right information about how to do it safely. And then your last line of defence is PPE, personal protective equipment. And the reason that's the last line of defence is because it protects only the individual. The other measures of control are very much about being able to protect anybody who's in or around that hazard, whereas the PPE is just for the individual. One thing that I would highlight here, if within your risk assessment you have got the wearing of particular PPE as a control measure, be that a hard hat, particular gloves, safety shoes, high-vis jacket, whatever it may be, if you've identified that as a control, the individuals undertaking that activity, they have a duty to wear that PPE because they have to cooperate with you in order for any measures that you've put in place to keep them safe. It's not optional. If someone says they don't want to wear it, well, you shouldn't be letting them do that activity then. It's not negotiable. If it's identified as a control, then it has to be worn. And you'll get people saying, well, I'll sign a disclaimer or a waiver or something. No. If they're not going to wear it, they're not doing it. So I've taken an example here of work at height and gone through that hierarchy of control. So avoid it. I'll take the example of maybe caretakers in schools going up on the roof to collect footballs and stuff like that. Do you really need to? Probably not. So if you don't have to, then don't. If you have to go up, find another way, a safer way of completing the task. It may be that I'm going to show you an image just in a couple of moments of a window cleaning device where nowadays, certainly not all window cleaners are going up on ladders to do top floors. They're using, the extendable poles with the window clean with a squeegee on the end and cleaning windows from the ground level. If you do have to go up, use an existing means of access where possible. And if there isn't an actual existing means of access to the roof, such as a fixed stairway or walkway, then make sure you're using the right piece of equipment. And I'll come on to that in a moment. For example, you're going to say, well, obviously it's going to be a set of ladders. All well and good, but make sure it's the right set of ladders. Make sure that whoever's doing that work has had information, instruction, training, and that there is a level of supervision on occasion to ensure that they're putting into practice that instruction and training and they are following the right procedures. In some instances of working at height, you would use pieces of equipment to either minimize the distance of a fall or minimize the consequences of a fall, or to prevent the fall altogether. So it's fall restraint and fall arrest systems where you would wear a harness and be clipped in to a cable system on the roof. And either the bungee system would be such that you were restrained and couldn't get to the edge, the distance to reach the edge of the roof, or if you were having to work by the edge, it would be a system of arrest, which would stop, if you did fall, you would only fall a certain distance before the actual equipment arrested your fall. You have to make sure that the equipment you're being used is inspected and maintained, and if you can, just store the items at low level. If it's about retrieving items from height. So I mentioned before around the window cleaner option. You've got things as well. I mean, some of them do have cost implications, but what cost keeping people safe? If it's something that's done regularly, surely that investment is worth it. Remember, they're reasonably practicable. In terms of, for example, lighting fittings now, a lot of modern buildings, rather than you having to go up on a tower scaffold 3 or 4 meters up to change a light bulb or light fitting, they have light fittings on pulley systems on so that they come down for you to change the light and then they're sent back up. So there's lots of different measures. I mentioned before as well ladders, and I think this is worth a point. There are 3 different types of ladders. You've got Class 1 industrial, BSEN 131 trade ladders, and then there's Class 3 domestic ladders. You should not be using Class 3 domestic ladders in any kind of work activity or the environments that you're in there. You'll see the picture there, it's got that is a Class 3 domestic, but also be aware that ladders will have a maximum permissible load, a safe working load, and that is usually displayed on them as well. So moving on to step 4, you've looked at your hazards, you've identified who might be harmed and how, and you've thought about some control measures that you can put in place. What you now need to do is record your findings on your risk assessment, but you also need to implement those control measures as well. So your risk assessment, what I'll do, I'll send with the slides a template that we use, very basic, because I think keeping it simple is good, and I'll show you an example of the template shortly. So if we go back to legal requirements, if we were being specific here around the legalities, if an organisation has fewer than 5 employees, you don't have to write that risk assessment down. But I'm telling you, good practice, make sure it's documented, because not only is it there then as evidence, but it also makes it easy for you to share the findings of your risk assessment with people. One thing I would warn against is using a generic risk assessment that you can maybe find or buy or download, because although it's a good starting point, because a blank piece of paper is often very difficult, although it's a good starting point, it must be made specific to your activity, how you're carrying out your activity and where it's going to take place. So just be wary. Don't be sticking to generic risk assessments. If you have them as a starting point, all well and good, but do make them specific. And it's absolutely no good at all having your risk assessment all filled in and filed away, and nobody knows about its existence or what the control measures that have been identified. So make sure that those risk assessments are and the findings and the control measures are shared with your employees, with your volunteers, so that they know what controls they need to be implementing. It's good evidence, good to be able to evidence that you've shared that. It might be in a meeting, in some minutes of a meeting, or get people to sign that they've seen it. And keep those risk assessments for reference. but make sure they're a living document as well. We'll come on to that in a moment. But yeah, make sure they're there, they're available, and people can refer to them. And you remember I mentioned previously about supervision and making sure that people are putting in place the training and knowledge that they've been given. Well, do make sure as well that they're implementing those control measures that have been identified. Remember that PPE, if they've got to be wearing it, they've got to be wearing it. It's not a choice. If you've said that certain controls have to be in place, then they have to be in place. So the final step of risk assessment is around reviewing your risk assessment and updating it. Now, with the review of a risk assessment, we would normally say it should be reviewed probably annually, but it's dependent on how hazardous the activity is. If it's a very hazardous activity, which probably I would hope maybe you're not doing, then it should be reviewed more frequently. But in addition to a general review, just to make sure it's still current, it's still appropriate, nothing has changed. If you know that there's been a change in circumstance, so there's maybe different volunteers, people with different levels of skill around that activity, if there's a change in legislation, if there's a change in equipment being used, then it should be reviewed also. And of course, if there is an accident or incident involving that particular activity, then it would need to be reviewed again too, just to make sure, is there any changes? Have we got the right things in place? Did the accident happen because the controls weren't being adhered to, or are there additional controls that we need to consider? There are also some very specific risk assessments that you will hear about. Some will be relevant to you, some won't. All buildings should have a fire risk assessment. These are not things that you yourself, you wouldn't do this. You would get somebody in who's competent in fire risk assessment, but the responsible person for a building under the regulatory reform order would need to ensure that. Again, in terms of buildings, there should be a Legionella risk assessment. If the building was built prior to 2000, it should be surveyed for asbestos, and that is, we call that a risk assessment only in terms of the fact that once the survey is completed, if asbestos is identified, a register is kept and it is rated, the level of risk associated with whether that asbestos is likely to be disturbed or become damaged and thus release fibres. In terms of first aid provision within your organisations, then there should be a first aid needs assessment. So that's based on the level of risk associated with what you're doing, with your service users, your volunteers, because you need to also consider when you're providing first aid, any individual existing medical needs. So you might have a lot of volunteers who are maybe a little bit older. You may know that they have specific medical needs. You might have someone who's diabetic, for example. So all those things need to be considered and documented and assessed. DSE assessments, that is display screen equipment assessments. If you've got people who are using computer equipment for periods of an hour or more on a regular basis, then they should have a DSE assessment which assesses the risk of musculoskeletal disorder, the risk to eyesight, that type of thing in the setup of their workstation. Control of substances hazardous to health. So if you're using substances, cleaning substances, anything like paints, if you're doing any sort of woodworking, machinery work, and there's any kind of substances used as part of that, then you would need to do a very specific COSH risk assessment as to how you are using that substance. With these things, with chemicals and substances, you will get a safety data sheet, which gives you all the components of the substance and the risks that are associated with it, and also recommends the PPE that needs to be worn when you're using it. Anything that's got one of the orange sort of warning symbols on needs a COSH risk assessment. And again, I'll send a template out with this. Manual handling, if there are very specific manual handling actions being done, that should have its own risk assessment. I mentioned earlier, new and expectant mothers. And you might have an employee or service uses specific risk assessment if there are any particular requirements around an activity or capabilities. A point of work risk assessment or a dynamic risk assessment. We do these every day, don't we? When we cross the road, we make an assessment of the level of risk prior to crossing the road. But these are the types of things usually that would be used by emergency workers, emergency response officers. You can have the best risk assessment in the world, but if you're in an emergency situation with lots of different activities happening all at once, then you have to assess. You need to assess there and then on that time. So this is the risk assessment template that we use. Very straightforward. You would list your hazards here. You would, for each hazard, decide who might be harmed and how. And you would give a risk rating to that hazard prior to having any control measures in place. So if I move on there, you'll see the key that we use, high, medium, low. You will see some risk assessments that look like some kind of mathematical enigma. You don't need that. We just need to say, is it high, medium, or low, based on these criteria here. You would then document your control measures. And once you've got those control measures in place, what the idea is that your risk rating that you've identified here will be reduced. So if it was high, you would be aiming for these control measures to bring the risk rating down to either medium or low. It might be that even then you've put these control measures in place, but there might be other things that you know you can and should do. And you would detail those here and allocate whose responsibility it was and a deadline by which these additional measures should be put in place. Anytime that your risk assessment is reviewed, you should document that so you keep a record of it there as well. Now, what I'm going to do, I'm just going to take you through a couple of cases. And these are actual cases that I've taken. So in 2010, Mental Health Matters was fined £30,000 when a new member of staff was tragically killed by a dangerous service user who she should not have been allowed to visit alone. The prosecution accepted that her death was not caused by mental health matters, but said further risk assessments and training should have been carried out to protect her. This case was sentenced prior to the change to sentencing guidelines. Now, the fine now under basically the sentencing guidelines, they changed in 2015. And now for something like this, for any health and safety prosecution, the fines are unlimited and there is a potential custodial sentence. Now, in terms of a business being prosecuted, the fines are based on the annual turnover of that business. If it's a non-commercial business, so if it's a public body or an organisation that's based on funding, the fine is based on the level of funding of that organisation. So that's where they've come up with now, potentially, the fine would be in excess of £100,000 potentially. So in this case, the charity, they were aware of the history of violence of this person, and they were also aware that his condition was worsening as well, but they hadn't made but they had still allowed that staff member to visit him alone in his house, and that is why they ended up being fined significantly for that. The next case here, this is 2017. And this is Hull Trinity House. They were fined £20,000 under Section 3, of the Health and Safety at Work Act. And this was after an electric shock incident when the mast of a sailing dinghy touched an overhead power line. This was a girl who was in a group of 14 youth volunteers, and they'd been moving moored boats to cut grass at this water adventure centre. Now, the adult who was supervising the group had gone to get insect repellent, and he heard a loud bang, saw a flash, and a young female fell to the ground. She suffered an electric shock. She was left semi-conscious, and she required CPR. Luckily, though, survived. And there was a separate case. So aside from the £20,000 fine, there was also a separate civil case for compensation, but I haven't been able to find what the outcome of that was. So yeah, quite significant. If you want some general further information, if you look at the HSE, they've got a guide to risk assessment. The document is INDG 163. It's free of charge. You can download it. And they also have some dedicated pages around voluntary work, and the kinds of control measures that need to be in place and what the things that you need to consider there. So that's a really useful resource. And that brings the session to an end. And for any questions, I'll stop sharing my screen.
Hi, I'll just